Bismillahirrahmanirrahim. Assalamu alaikum. Today we will discuss the disturbances in the structure of enamel, and our topic for today is amelogenesis imperfecta. Amelogenesis imperfecta. Amelogenesis imperfecta is a heterogeneous group of genetic disorders exhibiting faulty enamel formation. So it is a complicated group of conditions in which there is fault in the one of the stages of the development of enamel. Amelogenesis imperfecta is a heterogeneous group of hereditary disorder of enamel formation. It affects both the primary and permanent dentition. These disorders are confined to the enamel. The other components of the teeth are totally normal. Now, during normal enamel formation, there are three stages through which the normal enamel formation progresses. Number one is enamel matrix formation, which is carried out by functioning ameloblasts. Number two is mineralization of enamel matrix, which is actually primary mineralization. And number three is enamel maturation, which is secondary mineralization. Three basic types of amelogenesis imperfecta correlate with the defects in these stages of development. Now, number one type of amelogenesis imperfecta, is hypoplastic type, in which there is a focalized, it can be focal or generalized, affecting all the teeth or some teeth. It exhibits decreased enamel matrix formation caused by the disturbance in the functioning of the ameloblast. Now, number two is hypocalcified type, which exhibits a severe defect in the mineralization of enamel matrix. And number three is hypomaturation type, which exhibits a less severe alteration in the mineralization. And it can be in focal areas of immature enamel crystallites or generalized area of immature enamel crystallites. Now, based on these three types, their clinical features are different, their radiographic features are different, and the treatment is also different. Now, AI stands for amelogenesis imperfecta. It can be hypoplastic, hypomineralized, or mixed combination. In hypomineralized, there can be hypocalcified or hypomature. Hypoplastic can be described as pitted, rough, or smooth. In hypoplastic type, the enamel is thinner than normal in focal or generalized areas, and the radiodensity of the enamel is greater than that of dentine. In hypocalcified types, in hypomineralized, there is hypocalcified and hypomature. In hypocalcified type, the enamel is of normal thickness but softer than normal and can be easily removed with a blunt instrument. The enamel is less radiodense than dentine. In hypomaturation type, the enamel is of normal thickness but not of normal hardness and translucency. The enamel can be pierced with the point of dental explorer with firm pressure and can be chipped away from the underlying normal dentine. Enamel radiodensity is about the same as dentine. The mildest form of hypomaturation type exhibits enamel of normal hardness and has white opaque flecks in the incisal areas of the teeth, which are also called as snow-capped teeth. In the figure, you can see the tips of the teeth are the coronal areas of the teeth are covered with the snow white flecks type incisal areas. Now, it can also be the emergence imperfecta can also present as the combination of hypomineralized and hypoplastic defects on the same or different teeth. The clinical appearance of the various types of amelogenesis imperfecta can be remarkably different. In some types, the teeth appear essentially normal, whereas in others, they may be extremely unsightly or obviously abnormal. Both dentitions are commonly affected to some degree. In the X-linked subtypes, the clinical appearance differs between males and females. Now, the hypoplastic is usually autosomal dominant, but it can also be autosomal recessive and X-linked dominant, whereas hypocalcified is autosomal dominant or autosomal recessive. And now we'll see the differences in the radiographic features. The radiographic appearances of amelogenesis imperfecta varies with the type. In the smooth hypoplastic type, the enamel layer is conspicuously thin and its radiodensity is greater than the adjacent dentine. In the hypocalcified type, the enamel layers appear whipsy or absent and is usually less radiodense than the adjacent dentine. And in the hypermaturation type, the radiodensity is almost equal to that of the normal dentine. Now, hyperplastic, the first picture shows the hyperplastic types, where the radiodensity is greater. There, the third picture shows hyperplastic, and it has pits on it. If you can see clinical features, there are pits. Now, the upper picture is of hypomineralized, and the lower is hypomaturation, a very advanced stage. Now, the treatment disorder. Amelogenesis imperfecta is a genetic disorder that affects the development of tooth enamel, leading to various dental issues. Treatment options basically focus on addressing the aesthetic and functional problems caused by the condition rather than curing it. So it cannot be cured as it's a genetic disorder. So the treatment options can be restorative, can be cosmetic, and they can be orthodontic procedures. Now it depends. It depends upon the condition. In restorative procedures, treatments are dental crowns. Crowns are used to cover and protect teeth in case of severe emergencies imperfecta. Dental implants replace missing teeth. Composite resins and onlays. These materials can be used to repair and reinforce teeth, especially in cases where enamel is thin or brittle. Then another option is porcelain veneers. They can be used to improve the appearance of teeth, particularly in front teeth. And GIC, glass ionomer cements, which can be used to fill in gaps and protect teeth, especially in primary dentition. Then there are stainless steel crowns, which are often used in children teeth to protect and strengthen them while they are still growing. Then they can be overdentures. When teeth are missing, overdenture can provide a functional and aesthetic function solution. Now in cosmetic, we have a bleaching to reduce discoloration, improve the overall appearance of teeth. Tooth bonding, applying a composite resin to the surface of tooth to improve its appearance and shape. Then veneers are thin tooth colored shells that are bonded to the front surface of teeth to improve their appearance. Then comes the orthodontic treatments, which may be necessary to correct the bite if the bite is misaligned or address other dental alignment issues. In some cases, where the jaw is affected, uh, there may be a need of orthognathic surgery. Other important considerations while treatment of emergencies imperfecta, we must start treatment early intervention, ideally during childhood. Then it will help prevent further complication and improve long-term oral health. Then there it's the treatment consists of multidisciplinary approach rather than a single discipline approach. Team of dental specialists including orthodontists, restorative dentists, surgeons may be needed to provide comprehensive care. Patients should be educated completely, and their families should be educated about the condition, treatment option, and the importance of maintaining good oral hygiene. And there should be regular dental checkups, then regular dental follow-up, so that the if we can check that the condition is not worsening, it should be monitored, and the effectiveness of treatment can be ensured. Then these patients are strictly advised to avoid excessive sugar intake and acidic foods and beverages, so that because enamel is not there to protect the teeth. Enamel is not strong enough, or it is not, or it is hypermineralized, or it is hypermatured. So uh, they should strictly avoid excessive sugar intake and acidic food to help protect their teeth. That is all for emergencies imperfecta. Jazakallah khairan kasira.